come. More on that tomorrow at 5 a.m. American health care as we know it could change forever. Last night the House agreed on a major health care overhaul by 5 votes. It is an ambitious plan, but with 2,000 pages to the bill, it's hard to see exactly how it affects all of us. So tonight, Channel 8's Monica Diaz breaks it down.
The bill is passed.
The trillion-dollar House health care package comes close to 2,000 pages. The massive bill would impact nearly every American and overhaul the insurance industry.
The measure would require most Americans to get health insurance or face fines, up to 2.5% of their income. Some employers would face penalties up to 8% of their payroll if they don't provide coverage.
Those who cannot afford insurance would apply for federal subsidies to buy coverage from private companies or the government's plan. Insurance companies would no longer deny coverage to anyone with pre-existing conditions or charge higher premiums based on gender or medical history. And adult children younger than 27 cannot be removed from their parents' policies by insurance companies. Coverage will be extended to 36 million people now without health insurance. To pay for that, the plan calls for chopping Medicare spending by more than $400 billion in the next 10 years, and a new tax on the wealthy, a 5.4% surcharge on the annual incomes of more than $500,000 for individuals and $1 million for families. Monica Diaz, Channel 8 News.
President Obama hailed the passage of the bill and praised those who supported it.
Given the heated and often misleading rhetoric surrounding this legislation, I know that this was a courageous vote for many members of Congress.
Only one Republican, a lawmaker from New Orleans, voted for the measure. The bill now heads to the Senate. Most GOP lawmakers say the bill is, quote, unconstitutional. Representative Joe Barton of Arlington said, quote, I just don't think it's right in the guise of helping Americans to mandate what they have to do. I just don't think mandating to Americans is a good idea. Representative Michael Burgess of Louisville went on to say the bill failed physicians who need tort reform and higher Medicare reimbursement rates. So of the 10 North Texas representatives, only Democrat Eddie Bernice Johnson voted in favor of the health care reform. The other local Democrat crossed party lines and voted against the bill. Chet Edwards said there's too much spending in it. As expected, all of the Republicans from North Texas also voted no. Now, while the Senate still has to vote, there are some major differences in their bill. The House requires employers to provide insurance for workers. The Senate bill does not. The House plan costs about $1.2 trillion over 10 years. The Senate version's more under $900 billion. The House also pays for expanded health care by raising taxes for the upper class. The Senate wants to use a variety of taxes and fees, including a penalty on high-cost insurance plans.